On the first day of 2020, the State Department of Public Health says Georgia once again passed 8,000 new COVID cases. 278 new hospitalizations were reported, as well as 17 new deaths. Over 4,500 Georgians are currently hospitalized with COVID-19. As we ring in 2021, over 575,000 Georgians have tested positive for the virus. With record rates in Georgia, you may be wondering what to do if you come down with symptoms, but you're not sick enough to go to the hospital. Sarah Hammond has this advice from doctors.
We've told you some of the best ways to avoid spreading the virus to others and what tools hospitals are using to help people recover. But what if you're not quite sick enough to warrant a trip to the hospital? What can you do to help yourself recover at home? A headache, loss of taste and smell, and fatigue are common COVID-19 symptoms, but they typically don't mean a trip to the hospital. Dr. Dan Stewart with Houston Healthcare says if that's the case, you should start by taking vitamin D and zinc.
Said to kind of help with our immune system in fighting this virus.
He also says you need to stay hydrated.
Hydrating and taking either Tylenol or fever and just general feel bads.
Stewart says for patients at the hospital, they'll do what is known as proning, meaning they'll flip them onto their stomachs to help with oxygen saturation.
That is something you could do at home if you are sick with the disease. You can certainly do some self-proning and help you breathe easier.
But Stewart says above all, you need to monitor your symptoms to ensure they aren't getting worse.
Are you experiencing higher fevers or you start having problems breathing? Go be seen. Don't wait till it gets worse. Go ahead and go earlier than later.
And remember, the CDC says if you're having trouble breathing, having chest pains, are confused, or have a bluish tint to your lips, that's when you should seek emergency care. Reporting for 13 WMAZ News, I'm Sarah Hammond.
Dr. Stewart says if you do have the virus, it is vital you stay at home and away from non-infected family members. And remember, none of what Dr. Stewart just mentioned is a cure for COVID-19. They're just meant to help you with your symptoms.